Hello, everyone, and welcome to another segment of For the Health of It, a new segment on health and wellness dedicated to getting important information out to you and to our community. Today, I am excited about the guest that we have today and the subject matter that we have to present. It is extremely serious and important. So family, I pray that you share this with your loved ones, that you take note of the information that is being shared because it's going to bless your life and it can certainly help save many lives. Today, we are blessed to have our guest with us, Dr. Norma Smalls-Manty. Dr. Norma Smalls-Manty is a critical care physician at Howard University Hospital. She has studied and did her work in critical care medicine and trauma surgery. And she is a very proud graduate and alum of Howard University School of Medicine. Dr. Manty, it's good to have you here today. We have heard so much about the number one killer in the United States. And of course, you know, just some of the disparities in Black and brown communities when it comes to heart health. Can you talk to us a bit about a heart attack? And that's what we're talking about today, this number one killer. What is a heart attack? Can you explain that?
Exactly. Well, a heart attack happens when a part of the muscle of the heart doesn't have any blood supply. For some reason, it loses its blood supply, and that's when you have a heart attack. That portion of the heart that doesn't have the blood, because the blood, of course, carries all the nutrients and oxygen throughout our body, that portion of the heart that it's affecting is damaged. So we might ask, well, how common are heart attacks? It is very common in the United States. It is the number one cause of death in adults in the United States. And the persons, when we look at all persons who have had a heart attack all over the country, all over the world, they are persons who are male, those who are older in age, and those who have a family history of heart attacks. Maybe that would be a parent or a grandparent. So when we're looking at what type of symptoms we may have, how do you know that you might be having a heart attack? You're going to have pain in your chest. Chest pain is that big sign that something dangerous is happening in the heart. Those type of patients, sometimes they're leaning over, they're very anxious, they're grabbing their chest. The pain can be mild, but in many cases it's very severe. It's like a squeezing sensation, like pressure on the heart, and it can radiate to the left jaw, to your left arm, or to the back. And when you're having a heart attack, you also may feel very weak and very short of breath as well.
Okay. And so if anyone listening, if you're experienced, particularly men, you know, we tend to kind of try to tough it out. And if we feel something, we say, well, maybe it's gas or maybe it'll just pass. I'll lay down. But you just said that these are indicators that we ought to take very seriously and go get checked out immediately.
Exactly.
Okay. All right. Dr. Manty, how is a heart attack treated?
Well, you mentioned one important aspect of the treatment just a second ago. That is getting help as soon as possible. The longer the time between your having the heart attack, start that blockage of the blood vessel, to the time that treatment is undertaken to restore blood flow to that portion of the heart, the longer that period of time, the more damage there is to the heart. So you should call 911, you should get to the hospital. They're going to do a series of tests to make sure that is indeed what you are having. And from there, you will either get medications or you may need a procedure. Now, years ago, the procedure was something more elaborate. You would more likely have open heart surgery, but now medicine has progressed and you might have something that is less invasive. It's actually a catheter that is put in from the blood vessel in the groin and spread up to the blood vessel in the heart, and it has a little balloon at the tip of it. And when the balloon is blown up, it will open up the blood vessel. Remembering that the biggest thing that you're trying to do is open up that blood vessel that has been clogged from a buildup of fat or cholesterol in the blood vessel.
Okay. Okay. Now, Dr. Manti, my mother always taught me that a ounce of prevention is worth more than a pound of cure. So we want to be sure to avoid it. So I think prevention is key. What can we do then to prevent having a heart attack?
Well, there are luckily, thankfully, a number of things that we can do to either prevent ourselves from having a heart attack or to enhance our recovery so we get back to more of our pre-heart attack state. So if persons who have high blood pressure and persons who have diabetes mellitus are at risk, many for having a heart attack. So if you're managing that by keeping your diet low in salt, low in sugar, low in fats, you have to adhere to that very, very strictly. Or if you're taking your medications, make sure you don't miss them. Now, diet is very important. You want to, even if you don't have diabetes mellitus or high blood pressure, hypertension, keep that diet low in salt, keep it low in fat, and a plant-based or vegetarian diet is absolutely best. Stay away from too much of the red meats as much as possible. As we know, you can get your protein from your beans and your nuts and your seeds. So just as long as you're getting enough protein in your diet, you should be safe. And then exercise, regular exercise, and weight control. And all those things should help you to either prevent you from getting a heart attack or it helps you to recover.
Okay. Excellent. Everybody, did you hear that? Did you catch that now? It does not have to be inevitable. We can do something about it. Eating right, diet, exercise, these are things that can help prevent heart attacks. It's important. Dr. Manti just let us know it's important to know our family history. So let's get talking in our families and be sure that we know what the health history is so that we can get the screening that we need and then start taking the preventive care to ensure that our families can survive. We can be well without having the traumas of becoming victims to heart attacks. Valuable information. Everyone, I pray we want to encourage you. We're sharing this. We encourage you to share it, to like it, and to make sure to forward it to someone that you know would be blessed by this information. Until then, may God bless each one of you, and let's continue living lives of health, prosperity, and wellness. God bless you, and keep the faith.
Thank you.